Hey, this is Mallory Dehart. So I wanted to talk to you about medication noncompliance and the use of short message services into everyday practice. So as a future advanced practice provider, we all know that medication noncompliance is going to be an issue that we're all going to have to face at one point in our practice. So one way to address this that I found through numerous research studies as I was researching this project was it's a short message service system. Basically what it is, it's text messages that are sent to patients through an app. It reminds them when to take their medicines, if they haven't taken their medicines, that they need to take their medicines. And I think this would be a great kind of tool for practitioners to use as well as other primary care physicians throughout the course of the care for the patient. So let's talk about some objectives. My goals, kind of the purpose for doing this. I wanted to improve medication compliance by 50% in these patients. And kind of one of the more important aspects of this, I want to improve the overall quality of life and promote, lifestyle changes so these patients can go on and kind of continue their regular, regimen at home and not feel restricted with these medicines that they have to take. So let's talk about some methods that I used. So some methods included, they had to be greater than 20 years of age. They had to have a hypertensive diagnosis. That was kind of the main focus, one of the chronic health conditions that I focused on. And then they had to have a reported medication noncompliance history less than 50%. So what we did a pre and post questionnaire as well as the Cronbach Alpha Scale. So what we did, we looked at the mean of the Cronbach Alpha Scale as well as we looked at the pre and post questionnaire results, and we wanted to find a common kind of average barrier for these patients, something that they reported as they commonly, why they didn't take the medicine, whatever that reason would be, whether they felt like, it restricted them from what they wanted to do, whatever that may be. So we also did follow-up phone calls with these patients. About every 1 to 2 weeks, we either visited them or we did a phone call just to ensure that they were sticking to this plan of care. Now, we all know that this new evidence-based practice can improve patient satisfaction as well as cost effectiveness for the provider. And that was kind of the main focus of this, was to improve medication adherence while being cost effective, and it's easily accessible as long as you have a cell phone and you're able to read and receive text messages. So as far as limitations on these study designs, I used 4 randomized control trials for this, and they all showed an improvement in medication adherence. One in particular, the Huang et al. 2013, showed a 90.1% improvement with the use of the short message services. And then I had another research study that looked at the use of it with stroke patients, and then one with HIV, because we know HIV is on a very strict medication regimen. And all of these showed a drastic improvement in medication adherence, and actually all 4 of them recommended the use to friends that may be dealing with the same problem. So, just some special acknowledgments. I want to thank Eastern Kentucky University for the privilege in letting me do this project and implementing this project. And then I also just want to do a little quick closing statement. So this just concludes the presentation about the SMS services. We do need to do further research to kind of properly look at maybe some barriers that we might encounter before we implement this, but I do think this would be a great way to provide medication adherence and be cost effective. Thank you.